Good day, everybody. Today we're going to start looking at joint mechanics and joint injuries. So the first thing we need to talk about are the three different types of joints. The first type of joint is called a fibrous joint, and a fibrous joint is a joint you might find in the head, and it's basically immovable. So fibrous joints are immovable. The second type of joint is called a cartilaginous joint, usually found in the vertebral column, and they are slightly movable. And our last type of joint is called a synovial joint. There are 6 different types of synovial joints, and they are free moving. So let's take a look at those 6 types of synovial joints. The first type of synovial joint is called a ball and socket joint. So it's where the head of a bone fits into a fossa. So for example, you've got your hip joint and you've got your shoulder joint, would also be a ball and socket. The next type of joint we're going to take a look at is a gliding joint. It's where they slide back and forth in 4 different directions, and those would be the tarsals and the carpals. The third type of synovial joint is called a hinge joint, and you can find that here in the elbow, and you can also find one in the knee. A pivot joint you can find in the neck, where you can move it from side to side. A saddle joint is one where you can move it in 3 different directions, and a good example of that would be your thumb. The last type of synovial joint is called an ellipsoid joint, and it's where you can move it in 4 different directions, and a great example of that is the wrist. The characteristics of a synovial joint. Key things here are you've got your bone, okay, and then you've got your bone down here, and on top of the bone we've always got cartilage, and remember that the cartilage is to protect the bone from gliding against each other. So once again, that's called articular cartilage. Then you've got a tendon, and so behind the tendon is a little blue thing called a bursa sac. And the job of the bursa is it's a little fluid-filled sac, and its job is to make sure that the tendon and the bone don't rub against each other, so it kind of protects it there. Next, we've got to take a look at the joint cavity, and it's filled with synovial fluid. So let's just fill in the synovial fluid here. And the synovial fluid is what allows it to be free moving. So if you were to put your foot up onto, like the back part of your foot up onto a table, you could freely move your patella around. The next thing we want to take a look at is the joint capsule. The joint capsule is made up of 2 parts. One is the synovial membrane. So the synovial membrane is on the inside here. And the synovial membrane allows certain nutrients to pass through. So that's kind of the job of the membrane there. The next thing we want to take a look at is on the outside, and that's the fibrous capsule. And the fibrous capsule's job is to keep synovial fluid from leaking out. So it keeps synovial fluid from leaking. So that's the job of the fibrous capsule. The job of the synovial membrane, again, was to allow certain nutrients to pass through. If we take a look at the difference between tendons and ligaments, key thing is that tendons attach muscle to bone. So here you can see you've got your rectus femoris attaching, which is a muscle, attaching to the bone, the patella, and so muscle to bone is a tendon. When you go and take a look at a ligament, it attaches bone to bone. So here you've got your patella bone down here to your tibial tuberosity, and so bone to bone is a ligament. Now a couple of things here. Tendons are composed of collagen, which allows to keep your skin elastic and tight. It's got a lot of fibrous protein in it. And tendons are vascular, which means they have their own blood supply. Now, ligaments are a little bit different, and this is why they take longer to heal when you injure them. They are avascular, so they have no direct blood supply. So don't forget, ligaments take longer to heal because they have no direct blood supply. They get their blood through compression. There are many different types of sport injuries. We'll take a look at just a few here. There's something called strains, pulls, and tears, and often you'll feel those in your tendons and ligaments. Next, we've got tendinitis. Anything ending in itis is inflammation. So in this case, it's inflammation of a tendon. Laryngitis is inflammation of the larynx. Pharyngitis, inflammation of the pharynx. Arthritis, same thing. Dislocation. Bones displaced from its original location. So for example, if the head of the humerus comes out of the glenoid fossa of the scapula, then that would be a shoulder dislocation. A separation is where fibrous ligaments that bind the bones tear and separate. We often see this in the shoulder. Cartilage, that's what's surrounding the bone, and so it's what protects the bones from grinding against each other, and if you tear your cartilage, it can actually be quite painful. And lastly, shin splints. So shin splints, you often feel them down the front of your leg to either side of the tibia. So it's tearing of the interosseous membrane or of the periosteum, which is kind of the outside of that bone. And for shin splints, the only thing you can do is rest for about 6 weeks, kind of stay off of it. Usually you get it from pounding on hard ground. And you can also ice it, usually pretty helpful. So how are we going to treat an injury? Well, the way you treat an injury is with pressure. So you want to put a tension wrap around it. Another way to apply pressure is if you hurt yourself in hockey and had your hockey skate on, maybe you want to keep it on. If you hurt yourself in a basketball game and your shoe's nice and tight, you want to keep it on. Then you want to do the eye, which is ice. So sometimes you might want to put a cloth down and then the ice if it's too cold. Elevate it to reduce the swelling. So you often want to put your leg or the injured part above the heart. And lastly, R stands for restrict. So you want to restrict yourself from hurting the area, so whether it be restricting the swelling with a tensor bandage, using a sling to restrict the pain, or using crutches. And lastly, how do I know if I have an injury? You use the term sharp. So S stands for swelling. You could get swelling instantly or over a little bit of time. Heat. The area is going to be quite hot in temperature if it's been injured. Altered, it's not going to work properly. You're not going to be able to step on an ankle if it's hurt. You're not going to be able to move it as well as you used to. It might be a different color. Next, it's going to be red. So it's going to look a different color. So R stands for red, being a different color. And lastly, it's going to be painful. Painful to move, painful to touch. Next, we're going to move into different types of injuries. And then we're going to look at the shoulder joint and what's going on in there, the knee joint. And then by the end of the unit, you're going to get to create your own joint model.